Whenever we talk about radioligand therapy or radioisotope therapy, there are two aspects to that. One is the radioactive substance, and the other is the targeting ligand or the targeting vector. Now, that targeting vector is either a peptide or a small body or a monoclonal antibody, and the radioisotope may be a alpha emitter or a beta emitter, like lutetium, like actinium, like for imaging we can use gallium or fluorine-18. So it can be of different kinds of radioactive substances, and the two are labeled in a what we call as a hot lab. Now, labeling procedure is basically a chemical procedure which has to be done in a very sterile, and it's a very accurate, and it's a procedure which requires a lot of competence from the radiochemists. It requires the proper infrastructure. It requires very meticulous quality control parameters, because the entire labeling has to be done under sterile conditions, in a positive pressure kind of a condition where there is no chance of any contamination. The chemicals that are used have to be very fresh and have to be very meticulous. So the entire process requires a lot of training, very meticulous processes, and an eye to the highest level of quality assurance. That is one of the differentiators of a good system or a good institute which does labeling with very high accuracy and with meticulous eye to detail and to quality assurance, as compared to another institute where the labeling process may not be done with such good processes. And this is very important, because if the labeling is not good, the radioisotope inside the patient can go from the target to a non-target. So it can go into the bone marrow, it can go into the liver, it can dissociate from its ligand, and it can create havoc in the system. It can cause a lot of bone marrow suppression, it can cause end organ damage. So the whole thing can go for a 6. So it's very important to ensure that your labeling is meticulous, that all processes are maintained. It is preferably a GMP compliant or at least a near GMP compliant laboratory, and the people who are doing the labeling are trained and experienced in the labeling procedure.